Hello, my name is Dr. John Cavenfire. I'm a practicing orthopedic surgeon for 28 years in Southern California. I'd like to speak with you about gout, which is becoming very common and frequent and is causing a lot of problems. Allow me to give you a little bit of background about myself. In college, I did biochemistry, and I had done 3 years of medicine before I entered into orthopedic training. The reason that I chose this topic was becoming very common and is causing a lot of problems. The incidence of the gout used to be 3 per 1,000, mostly males middle age, but it's becoming so frequent within the last 15 years that it's not a joking matter. I'm seeing it in our young people at earliest age 17. It could cause pain and considerable amount of disability. Gout belongs to a group of conditions called crystal-induced arthropathy. Well, let's see what can it do and where can it go. In the old medical books, it says it goes to some of the big joints, and the most common place was big toe. But I'm not seeing that in the big toe anymore. I'm seeing it other places. When I say anywhere, it could go anywhere. One of the meetings that I attended a couple of years ago, the gentleman who was presenting gout, he gave us history of one of his patients that was suffering from chronic headaches. And nothing was working on it. They obtained CAT scan and MRI. They found a mass in the brain. And when neurosurgeon went in, they found the tophi. Tophi is like a round, small walnut type of shape, which is full of uric acid in it. In my practice in orthopedics, I have seen it a lot of places. It could go anywhere which you have a joint and a cartilage, which is called a synovial joint. The problem with the books are that's written by rheumatologists, and rheumatologists, of course, whatever they can examine, which is external joint, they rely on. About 15 years ago, one of my patients suffered from severe neck pain and back pain, and he is an elderly gentleman at 70. He gave me a history of gout, but he says he hasn't been taking any medicine. His x-ray looked really horrible with a lot of arthritis, and I thought, well, gee, the x-ray looks horrible, so that might be the cause of his pain. And his uric acid next day came back to be 13, so I put him on medications, and I refer him to a spine surgeon. The spine surgeons, which he saw a spine surgeon after 7-8 weeks, called me up and says, well, I agree with you that he has a horrible spine and he has a lot of arthritis, but he has no more pain. So that came to my attention that it was gout which was giving him trouble, and it takes about 6 weeks almost to clear up from the facet joints in the spine. That's why we can move our body and dance and do all the good stuff with it. So from then on, I've been examining facet joints in the cervical spine and lower back, which are accessible for palpation. I have personally aspirated uric acid crystals from shoulder, elbow, wrist joints, hip joints, knee joints, ankle joints, and of course from small joints in the hands, especially the long ones, distal phalanx, and of course the big toe. You really don't need to have erosion to see uric acid. Those who have chronic uric acid deposition, it gets inflamed, become very painful, and sometimes drains through the joint, like some of the big toe or the hands that I have seen. Also, it could deposit in the tendons. Since I'm a surgeon, I have repaired tendon ruptures, quadriceps, patella tendon, Achilles tendon. And there was uric acid crystals within the tendon. And these people that I've repaired, most of them did not have severe trauma, but a trivial trauma. I've never seen anybody who has ruptures of the tendon while they are performing regular sports on probably a routine basis or on a weekend to have ruptures. All of those patients who had ruptures, either they had a thyroid problem or gout or a combination. And of course, the recent incidence is Kobe Bryant in Lakers, which is pretty fit, and he has been playing for a long time. So the only thing that could cause weakness of the tendon, those are the most common things that I have seen, thyroid and gout. And of course, they are treatable. If you repair the tendon without treating the gout or thyroid problems, these people would be more prone to rupture other tendons and come back to you. Well, let's see what gout is. Gout is the end product of purine metabolism or protein. Protein metabolism becomes uric acid crystals. It goes through a lot of process, and the last stage is called xanthine oxidase, which is an enzyme in the kidney that converts it to uric acid that can go out through the kidney. Otherwise, it will not go out. Those who have elevation of uric acid, they could also develop renal crystals or kidney stones, which has a uric acid, which is called urate. Well, in the old books, they used to tell patients that if you have uric acid or you have gout, don't eat beef. Well, that was on the basis of knowledge of the doctor who wrote this, and he was seeing people who were aristocrats or rich people, and they used to eat steak or beef with alcohol. Precipitating factor was alcohol, not the beef. Because as you know, most of the common people, they believe that if they want to have a lean meat, they will eat chicken or turkey or fish. We have found out, and you have access to a computer, Google it and see which one has more protein in it. Of course, fish, turkey, and chicken compared to beef. So if you are suffering from those conditions, then you need to really go slow on chicken, turkey, and fish. I believe those people who have been using or like chickens, the percentage hasn't changed, and those who like to use beef, the percentage hasn't changed. Well, what has changed that has increased this incident of gout? Through my history taking from my patients, I found out that those who eat chicken are more prone to develop gout. And the only thing in the equation which has changed is quality of meat in the chicken or turkey or fish. As you know, before, most of the fish used to be wild fish. Now, most of the fish that you buy is farm-raised fish that they feed them genetic modified corn. The chicken and turkeys used to be fed a lot of grains, but since they have genetically modified corn, they are fed 100% genetic modified corn. If you saw the movie Food Inc., you will see that they were fed 100% genetic modified corn. And the chicken used to take about a year to be what's called market ready, but however, guess what? The chickens are continuously eating because they never feel full, and they get plump within 6 weeks' time, and then they take them to the market. Within 6 weeks' time, about a few percent of them, I estimated from the movie that about 5 to 6% die, and if they stay around, within a few more weeks they will all die because that genetic modified corn is damaging the chicken kidney and liver. That's why you hardly would find chicken liver anymore. That changes the consistency of the protein, which is a different subject for another time. If you are suffering from other conditions like leukemia or cancer and you're receiving chemotherapy, that could also increase the amount of uric acid, and that could give you gout. Well, uric acid, it's a crystal. Crystals are a couple of micron in diameter, and also they are 12, 13, maybe 15 in length. Crystals, they have a tendency of some of them sticking together. Well, let's see what's the diameter of the microcapillaries. Microcapillaries are the tubes that they would take the blood supply, oxygen, nutrition to your tissues. And one RBC can go through it at a time because RBCs are 6 micron in size. So you can see how much space is left in between. And a lot of other things that travels with the RBC. Fat, cholesterol, triglyceride, and albumin, including uric acid. Well, if it starts getting saturated, or some people call it supersaturated in blood, well, body needs to get rid of it. That's why they can travel through the microcapillaries, which are only 1 cell in size, and there is separation between the cells to allow certain oxygen nutrient to pass through. Well, once it gets to the tissue, chronically in a tissue, tendons could cause pain and inflammation and eventually ruptures. Sometimes, because of those microcapillaries and the places that they don't have a good blood supply, like facial planes, like your extensor surface of the elbow, or iliotibial band, or where the tendons attaches greater trochanteric area, you could get an attack and you go to the doctor with pain. And of course, when you get pain, your primary care, family practice, or internal medicine guy is going to look at this and says, oh, this is orthopedic, let me send you to the orthopedic surgeon. Orthopedic surgeons examine you, and if you have finger problem or thumb problem, which is called a tendonitis, and for tendonitis, gives you steroid injections, or you need a release, tendon release. Or if it's ruptured, they do repair. It never occurs to them that gout could do this. Well, when I see most of the patients who are suffering from the core vein, or tendonitis, or even carpal tunnel syndrome, there are few things comes into my mind, and one of them is gout. Because if that's the case, then that's easily treatable, and your pain will go away within 2-3 days with the proper treatment. All we need to do is stop the uric acid accumulating in your blood somehow and reduce the inflammation with the medication. If it goes into the joints, it causes inflammation, And when it causes inflammation, neutrophil comes in, which is one of your white blood cells, and they engulf them to reduce the inflammation. The more it comes in, the more inflammation you get. That's why if you have ever had history of gout, you will see that the joint is hot, we call it, or it may be even red. Okay. Well, when you develop tendonitis, some doctors, when the book says, give them a splint to keep them comfortable. Well, yes, that will keep you comfortable, but it goes on and on and on. And non-steroidal anti-inflammatory medication like ibuprofen, naproxen, Voltaren, or even Celebrex, they're called COX-1. They have some anti-inflammatory effect, but usually do not work well on gout. It helps with the pain through the pain-killing effect that most of these medications have. You need to treat the underlying problem, which is the uric acid. Well, of course, if you eat too much protein and your enzyme, you're not making enough enzyme, it's going to go up in the bloodstream. And then it will go wherever it wants to go, especially the joints that has been injured before, because it increases the blood supply to those joints, even if you had them 10, 15 years ago. Well, let's see what in the old book says about treatment. Well, it says if your uric acid is up to 8.5, now some of the books it says 7.5, you're okay, you don't need treatment. Well, for the last 15 years, for the last 28 years that I've been in practice, I never saw a patient with the uric acid about 6 to be normal. Because the problem is that the internal medicine and rheumatologists, they don't correlate. I wrote an article on this, unfortunately didn't get published, and there was a Japanese article that came out, and also there was an American article, and subsequently another more, that one of them indicated about 6.5, and the two others indicated about 6 uric acid is abnormal. One of the meetings they attended, and the doctor was talking about gout, one of the doctors asked him, when do you treat gout? He says, if they're symptomatic. And the question that came to my mind, if the patient was asymptomatic, what he was doing in the doctor's office. So you see how it could be misinterpreted. Anytime your uric acid is about 6, it could cause problem. And I didn't see a variety between different nationalities or different races so far. Well, let's say if you're going to a party and you would like to have a good time and they serve only chicken or fish, and rarely they do turkey except Thanksgiving, and you would like to drink, well, that should put you up about 6 if your uric acid is around 4.5 or 5. Therefore, it's necessary to give you a cushion. One of the other doctors in the country that I have reviewed his article agrees with me that you got to keep them below 5. I generally like to keep them below 4.5 because I have seen 1 can of beer or 1 glass of alcohol shoots it up between 0.5 to 0.7. Therefore, if you're having 2 or 3, you'll see how easily you could exceed 6. And next day, you wake up with the pain in your foot or ankle, and they call it plantar fasciitis, and they want to give you ultrasound or steroid injection, or some of the doctors, they want to give you surgery. And the reason that they want to do surgery, they tell you you have a heel spur. Well, majority of adults, as they go along, they would develop heel spur, and heel spur is not a problem. The problem is inflammation in the plantar fascia. That if you look at the anatomy books, those are white or yellowish are tendons or fascia, which they have a scanty blood supply. And if they have a scanty blood supply, guess what happens? When the microcapillaries get inflamed and they can't pass on nutritions and they can't get rid of uric acid, you end up with tendonitis called plantar fasciitis, iliotibial band syndrome, greater trochanteric bursitis, or lateral epicondylitis complex, which is the elbow, or it's called tennis elbow. All you need to do is bring the uric acid down and modify your diet. Well, what's the treatment? Well, it depends where is your uric acid. There are 3 medications which are being used. Okay, so if you're drinking 4 or 5 beer per week, or if you're using a bottle of wine every 2-3 days, well, all you have to do is slow down on those, and if you are 5.5 or 6, that may bring you down easily to less than 5. I believe in minimal effective dose of medication, because the higher the dose, the more side effect. So if the diet, and reducing the alcohol, we can solve that problem, you're done. All you need to do, if you're eating a lot of fish, chicken, and turkey, especially what's called farm raised, stop using those and go use some more beef. Your beef needs to be grass-fed, not corn-fed, because we have seen any animal which is corn-fed, it causes more problem. The same way it damages the kidney, liver of the chickens, and you don't see them anymore, or even the cattle's. You don't see the liver anymore because it's all gone. It's called a fatty liver, and it causes liver failure. That's why you don't see them anymore. Therefore, buy the best you can and be more vegetarian. A lot of things, vegetables, they have also high uric acid content, but I'm seeing less gouty attack than I'm seeing with chicken and turkey and fish. One of the vegetables which is very high in uric acid is oatmeal. Through the years, I've seen consultation for a lot of patients who had pain here and there, and when I walked into the room in the hospital, every morning they were having oatmeal. Well, oat has a high uric acid content. Usually peas is very high in uric acid. Mushroom is a good source of protein, but I haven't seen too much attack with that one. So there is variation between animal protein and chicken protein. Vegetable protein. So that could solve. But if your uric acid is higher, there are a few medications. One of them is probenecid. Probenecid, what it does, it prevents absorption of the uric acid in the tubules of the kidney. Usually, uric acid goes through the kidney glomeruli, which is the filtering mechanism, and 90% are reabsorbed through the tubules. This is what the probenecid does. And this works if your uric acid is around 6.5. If you're higher, it doesn't work. You need then allopurinol. Allopurinol or xyloprene is medication that stops the uric acid before it becomes uric acid, blocks what's called xanthine-oxidase. So you will never get it when it's crystals. And that works until you're 8. Okay, here is the problem with probenecid and allopurinol. If you have other conditions like arthritis or diabetes, which most of those medications go through the kidney, gets metabolized, then you can't have those, or very limited, because that puts a stress on your kidney. It depends on your kidney function too. Most what I have seen, doctors, they may check BUN and creatinine, but however, what I have seen, your kidney may be going down, 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 and its renal function may decrease considerably before it really starts breaking down and you develop renal failure. So what needs to be done is BUN, creatinine, and GFR, glomerular filtration rate calculated, which should give you accurate assessment of your kidney. If your GFR is going down with your medications and is reaching close to 60, it's about time to take you off those medications and then put you on a different class of medication. Unfortunately, most of the medications for diabetes, no matter what class, they go to the kidney, gets metabolized. And most of the arthritis medications also go to the kidney metabolize. So before the damage is completely done, that need to be checked at least every 3 months. Yeah, if you don't have a good kidney function, also you can't go on those medications. Next class of medication is Uloric. Uloric is a wonderful medication that goes to the liver, gets metabolized. So if you have a reasonable functioning liver and you don't have fatty liver to its function to be borderline, you can go on these medications. And those are the guidelines that needs to be used. Most of the insurances, unfortunately, they don't want to cover Uloric because Uloric, there's no generic for it, and it's a brand. But however, there are coupons. And also, if you go online and Google, how can I get my medication free, you may find out that there are options to get those medications. Well, all medications could have side effects. Some people could be allergic to those. Well, therefore, those need to be watched too. Any side effect that you get from any medications, you need to stop and report it to your doctor that finds options. The best thing is that I've seen in about 35% of the patients, if they modify their diet and reduce the alcohol intake, they don't need to take any medications. There are few over-the-counter stuff available that some people take. One of them was inflammasole that one of my patients brought in. And when he was using this, there was no attack of gout. But however, I saw his ear is developing more uric acid tophi around the ear cartilage, but he wasn't getting the attack. And his uric acid was about 8.5. So what it exactly do, it reduces the inflammation, but will it prevent complication? That's something to be answered. If you have developed gout or you have any inflammation such as plantar fasciitis, ankle which is warm and hot, and you have difficulty walking, okay, or any other joint, when you use the medications such as Uloric and also allopurinol or xyloprin, it may give you more attack. So in order to prevent the attack and prevent more attack, you need to have 3-4 days of 2 tablets of colchicine, which is now called Colcrase, 0.6 milligram. But the first time you use them, you got to use Colcrase or colchicine 2 hours before you actually start the allopurinol or Uloric. And all you have to do is take it for 3 or 4 days and you're done. If you have very severe attack, one anti-inflammatory medication that works on the inflammation is Indocin. All you need is 25 milligram for the next 5 days, and that's it. And then you see major improvement. You don't need to have surgery, you don't need to have steroid injections, okay? And you don't need to have surgery for plantar fascia or elbow or physical therapy. I've never seen those work faster than your treatment. Thank you for your attention.